evening. Welcome to Sound Health on Lagos Television. I am Ola Sumbo Modupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we try to enlighten members of the public on trending health issues from around the world. In the last decade, there has been an increase in cancer rates, about 79% in young adults. The World Health Organization says this statistics keeps rising on a daily basis. Today, we are looking at why we're experiencing this increase and what is the way to go in terms of precautionary measures. Stay tuned. The conversation begins after this break. Good evening. Welcome to Sound Health on Lagos Television. I am Ola Sumbo Modupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we try to enlighten members of the public on the program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Tebitope Olatunji Agubiade. She is a consultant radiation and clinical oncologist with the oncology department at the Lagos State University Teaching Hospital, and she is going to tell us why we are experiencing an increase in cancer rate in young adults. Good evening, Dr. Olatunji Agubiade, and thanks for joining us.
Good evening, madam. How are you doing? Thank
Good.
you for inviting me to this enlightening program. It's always a pleasure to impact knowledge on your platform.
All right.
Thank you.
All right. Thank you for always making time out. All right. There has been an increase in cancer rates in young adults all over the world. Nigeria is not left out. What exactly is the reason behind this sudden rate in the last decade?
All right. So let me quickly break it down to what we mean by the young adult. All right. We're talking about, on how do I even say it? We're talking about the adolescent, 10 to 19 years, the young adult, 10 to 24 years. Then, generally, any cancer that occurs in ages less than 50 years, we term it as cancers in young adults, just for the sake of inclusion, to make it for the sake of inclusion, why we have to go back and mention, from age 10 to 19 and all that, so we all are on the same page. So unfortunately, there is little certainty about what drives cancer trend in the young people, or better known as early onset cancers. All right. So let me quickly take it back, because some people may say, this may be the first time they're seeing me on this program. So cancer generally disorderly growth, all right, that can occur in any part of the body. It can begin from the cells, from one to double. It's just an haphazard growth. Disorderly growth, is taking its nutrition from the body at the detriment of the body itself, all right? God has done it in such a way that there is a programmed cell death, or if this does not happen, those cells continue to grow abnormally, all right? Sometimes it can be, there may be certain risk factors or some reasons why these things occur in this part of the body. So basically, we have a general knowledge of what cancer is, and if it starts in an organ, it grows in a cells, it grows to join multiple cells together, then it grows locally, becomes advanced, and it then goes to distant organs. All right. So this cancer we're talking about can then occur in any age bracket. But today, for the purpose of this program, we're talking about cancer occurring in young adults, all right, or otherwise known as early onset cancers. All right. So I think the reason why we're seeing it now is as a result of, one, I will say this, a better detection. All right. Early screening now. The fact that the screening age has been lowered in certain cancers. All right, talking about breast cancer now, you start saying from age 40, you are screening for breast cancers. You're doing mammogram for people that are less than age 40. They're doing ultrasound scan and even more advanced screening techniques now, talking about MRI and all that. People are now getting more aware. I think that is also giving us more information, or people with with the positive family history, knowing that their family members are positive. So people are now more aware and say, oh, what can be the cause? All right, particularly in the young people. Although we all know that in young people, I mean, the focus of their life right now is, oh, I'm just starting my life in terms of career, in terms of academics, trying to settle down, all that. Many people may not know, but the fact that they have a better understanding that their family members have this cancer, I mean, we've been able to diagnose quite a few of them. Then what are other factors? You know, we're talking about the environmental factors. There are toxins everywhere. I mean, there's pollution globally here and there. Talking about changes in diet. We are eating high residue, low fiber diet. There's a whole lot of red meat intake, and people are just not they're not living right. No, I mean, you'll be amazed. If a lot of people take soda, they take alcohol, they do tobacco and all that. So those can also affect. Then talking about lifestyle choices, what are we doing? Sedentary lifestyle? Are we doing exercises? Or are we just balling around? Or we are obese? We have fat tummies. We're not doing anything about it. We're just in one place. Some people are breweries. They don't even mind, irrespective of weekends. Monday, Tuesday, Friday, they don't even know when it's weekend. So they are always taking alcohol, taking cigarettes and all that. So other things that can also affect. Talking about infections with certain viruses. Let's talk about the human papilloma virus that is culpable in the cervical cancer. I mean, is responsible for like 90% of cervical cancers. The incidence is on the increase because what am I talking about? Okay, low to middle income country where we have people don't have money. I mean, they are careless about their health and all that. The multiple sexual partners and all, people are just generally careless and not even minding. So I think these are part of the reasons where we are seeing all these situations now, and it's rather unfortunate. All right, it's rather unfortunate. But the one that is really painful is one that you see in, you see whereby people are just they're just nonchalant about doing their checking and all that. But in actual sense, I mean, the good thing is that people are now more aware. The awareness is better now, and I think that's why we are seeing all these cases that are being reported.
All right, thank you so much, Dr. Olatunji Agunbiade. Okay, so let us look at the most common cancers you've seen in your practice in the last decade among these young adults. Because before all we hear is cervical cancer and breast cancer.
The commonest one generally is the breast cancer. I mean, I've had to manage 18-year-old with breast cancer. I've had to manage 23, 22, 24. I've seen in under 30s, and it's rather really unfortunate. All right. So I've seen breast cancers. I've seen thyroid cancers. I've seen colorectal cancer. All right. I've seen cervical cancer. I mean, we even get to see that with even other comorbidities, talking about they have HIV virus. They have this, by the time they do the genetic testing, they have the human papilloma virus and all that. The breast cancer, talking about the breast cancer, the ones I've seen, they are usually associated with the genetic mutations. Either there's a positive family history, maybe in the first degree relatives, first degree relative, you see it in them. Or even some people, the fact that I've managed their mothers or aunties and they send their children for routine screenings and all that, and they pick it up. So I have seen those cases. So talking about colorectal cancer as well, we talk about the Lynch syndrome. I mean, where they have a lot of polyps and all that, hereditary non-polymatous polyposis. I mean, they have the risk factors, all right? So in those kind of patients also, we are supposed to start our screening from 10 to 15 years, all right? 10 to 15 years earlier than the age at diagnosis of their first degree relatives, all right? Talking about the BRCA syndrome, Angelina Jolie made it very popular when she had the breast cancer and all that, and she had to go and do double mastectomy so that, it will reduce the risk of the breast cancer. So, I mean, this situation we've seen, I've seen BRCA gene positive, I've seen the genetic disposition in the Lynch syndrome, I've seen cervical cancer where the human papilloma virus, the HIV virus, immunosuppression are culpable. I've also seen uterine cancers. I mean, it's really amazing. I've seen testicular cancers in young people. I've seen thyroid. You can even imagine the prostate cancer that was previously, I mean, everybody had the notion that, oh, you can only see prostate cancer in elderly people. But unfortunately, I've seen it under 40.
Oh.
And the sad thing is that when these cancers occur in this young age, they are very aggressive. They are more aggressive in terms of the variants that they have. Unlike in the elderly age, where, okay, it's indolent, it's just there, it's just going. And going back to breast cancer, the commonest type that we see are the aggressive. We're talking about the triple negative breast cancer, talking about the HER2. So, I mean, these situations are really pathetic, all right? Notable other cancers too. I've seen gastric cancer. I've seen pancreatic, you know, and yeah, it's a huge burden. It's a huge burden on the health community, you know.
Okay.
Thank you.
All right. So, what are the odds of getting this cancer within that age bracket? Because you said people are aware, and you know they are also open to test early enough. Early detection has been helpful. So, what are the odds apart from genetics and lifestyle?
Okay, apart from genetics and lifestyle, in terms of having all these cancers.
Yes. What are the odds of getting cancer?
The odds of getting these cancers.
Yes.
All right. There are other risk factors too. All right, that can predispose. I've talked about infections. I've talked about smoking, alcohol. I've talked about genetic mutation. I've talked about even antibiotics use, antibiotics abuse. All right. So this can, on the long run, disrupt the composition of the gut, and before you know what is happening, you have these cancers in the gut. And it's just rather unfortunate that things are like that. But I mean, with better awareness now, people are getting more aware, and because of the screening as well, things are getting better too, and we're hoping to get more soon, you know. But the good thing is, if you catch it early, if we're able to catch it early, the outcome is always better. I mean, catching it at stage 1 disease, you and I know that if you catch it early at stage 1 disease and with a good grade, we have a chance of having a better outcome. But unfortunately, our people can be careless. I've seen situations whereby, oh, people, I mean, they present with these symptoms, oh, they're having rectal bleeding and all that, and you know, they just ignore it and say, oh, I don't have time to go to the hospital, or I'm still young. No, they just attribute it to hemorrhoid. Hemorrhoid is common, and they leave it for a long time, and by the time they are presenting, it's already at an advanced stage when they come.
All right.
Thank you.
All right. So let us look at precautionary measures. You've listed all the risk factors and all that. Let us look at precautionary measures. Can you prevent these? Are there steps we need to start, you know, taking to prevent the increase in cancer rates among this age bracket?
Yes, like I said, there are ways to curb the increase of this cancer in young adults. How do we address? We're talking about addressing this situation, right? How do we curb it? How do we prevent and all that? All right. There should be increased awareness and communication, all right? I mean, we should enlighten people to, I mean, talking about, oh, there's a family history. You should know your family history. There's a family history of cancer, and you know that, oh, this can be genetic. So from an early age, the family members should start screening, or they say, oh, one of their uncles had this one. So everybody has to start screening and to be aware of what is happening, that, oh, if it happened in uncle, this thing can happen. Oh, I have, by the way, doctor, my tummy is paining me. I have abdominal pain. But the fact that there's a positive family history, they can investigate in that direction. And in most cases, they may see, they may not, they may be lucky, you know. I've seen some patients do colonoscopy, and by the fact that there was cancer in the family, and what they found there was polyp. Some of the polyps may be malignant and some may not even be malignant at all. So also another thing is communication. It's not just to be aware, there has to be communication. I mean, you need to relate to people. This is what is happening to me. The healthcare personnel should also give all this information to know what it is. Then we should, on our part, pay attention to our body, because most often the symptoms and signs would have been there for a while before it then becomes something huge, or that we have not even been paying attention to it at all, and they're just saying, oh, it's something, I think I'll, So I mean, we should all get ourselves checked in no times. All right. So basically, screening is the number one thing. Screening is the number one thing. We should go for a screening. For people with positive family history, they should know that they should go 10 to 15 years, particularly for breast and colon, 10 to 15 years earlier in than the age of diagnosis of their family members that have this cancer. Then everybody should just have this culture of screening. In Nigeria, I know we're very poor at going for, and I know that the notable factor, finance and all that, because most people are paying out of pocket. So it's not easy for some people that don't even have enough funds to feed. They're like, oh, before I can go and do this one and do the test, it may take a while. But the thing is, I know government is trying their best now, and they're trying their best to see how this patient can be supported. Also, these NGOs. So I mean, NGOs are coming up to say that, oh, how can we support on social occasions, or so? I mean, when we have breast cancer awareness month, prostate cancer awareness month, so they offer to do screenings for patients. They offer to do cervical cancer screening for patients. So more awareness is coming up, and people are getting to know what is happening. We should get ourselves checked. Then also, and when this happens, there are groups, there are support groups that talks about this, and even if they have it or the cancer is already there, maybe during the diagnosis, they have support group that support this patient. Like in my clinic, I know of some young survivors. One of them is very popular. I mean, she's done cancer, she's been cancer free for 5 years, and there was a whole lot of celebration and all that. So you know what I do? Once I get new patients with cancer, I just connect them with her. I connect them and say, oh, this is what this person is going through, and she then goes ahead to counsel them and all that. So they do a lot better when they feel that they are not all alone in the game, they're not all alone in the situation. So there is better awareness. People are more. Then also, in terms of the diet, we need to let people know what is healthy, what is not healthy. People should go for exercises. See, then lifestyle, you cannot just be in one place all day long and all that. We should have exercise culture, go to the gyms, I mean, do walks in your estate, then improve on your diet, increase vegetables, increase food intake and fruit intakes, then reduce your meat diet. Then all this preserved foods, canned foods and all that, natural meals are better. Then okay, talking about even the cervical, we should go for screening. Now, I mean, government has done it in such a way that for children from like 9 to 12 or thereabout they are not sexually active, there are vaccinations. Take your children, take your words for vaccination. This will also further prevent the occurrence of cervical cancer. Like for me, I've got a teenager. I have a teenager. I mean, I had to make sure that she was vaccinated when it was available. So everybody got vaccinated. Talking about all these diseases, we can prevent some, we cannot prevent. Talking about genetic, we cannot prevent. There isn't much you can do. But the most you can do is go for screening on time, knowing that there's a positive family. And also, Jay, we know that there can also be some cases where they are sporadic. Sporadic means that they don't have a family history or anything, and it may just be one person in the family that they're even surprised they haven't heard something about anything like that before. For those ones as well, if we have good culture screening, we will pick those diseases early, and it will go a long way in curbing the menace, this cancer menace. And and it will even be a great deal for us. I mean, physicians, oncologists, when you have patient presenting early and you are able to have a better outcome, everybody is happy and proud of this. Thank you so much.
In 30 seconds, your final words to viewers at home.
All right. So, I mean, I would like to send this word outside. Screening. All right. prevention. How do we prevent? See, we have to go for screenings. We have to live a healthy lifestyle. We have to do exercises, watch our diet, and be aware of our family history. Be aware of what is happening around. We need to basically live right. All right. And those people that are going through it, we need to encourage them. I mean, there's nothing to be ashamed of. If you have any new diagnosis, come out there. If after you've been screened and they pick anything, prompt treatment, prompt diagnosis, prompt treatment is the way forward. We'll catch it early and we'll have a better outcome. But in all, screening, we should all have a good screening culture. And like I said, in those with positive family history, start your screening earlier, 10 to 15 years earlier, so that we'll be able to, because unfortunately some of this cancer, they're talking about the cervical cancer, talking about the colorectal cancer, talking about even the BRCA gene positive cancers. They may be there. Once it's positive, you know, they may just be there lying fallow. Then years later, before you know what is happening, they are back. They are boom. They are like in your faces, and you're like, where did this come from? But lo and behold, it's been in the background and it's just growing, and you know there. So the good thing is, go out there, screen, know what is normal in your body from abnormal, know what it is. That pay attention to little things in your body. Don't ignore things. Go for checks every now and then. Live a healthy lifestyle, and you know, not sedentary. Improve on your diet. All right. And so I'm sure when we're able to do all this, I know it's God that protects. Sometimes doctor may do their best. We may think that, we may think that we've lived right, and this thing still occurs.
Right.
I get to meet some patients that tell me that, doctor, but I've lived right. I don't eat. I eat a lot of fish. I eat this. I eat that, and they still come down with it. I pray that God will help everybody. Thank you.
Be aware, prompt diagnosis, screen early, and that's the way to beat cancer early. Dr. Temitope Olatunji Agumbiade, consultant radiation and clinical oncologist, thank you so much for your time and expertise on how to prevent cancer in young adults.
Thank you so much for the opportunity to impart knowledge. It's always a pleasure coming on your program. We look forward to working together in the nearest future. Thank you so much. God bless you.
Welcome. And you too. I have been speaking with Dr. Temitope Olatunji Agumbiade, consultant radiation and clinical oncologist with the Oncology Department, Lagos State University Teaching Hospital. And she has been telling us why we're experiencing an increase in cancer rate in young adults and how to prevent it. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television. You've heard what Dr. Olatunji Agumbiade shared with us on prevention of cancer in young adults. You need to screen early. You need to be aware of your body. You need to also spread the information and support people diagnosed with cancer. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 and follow us on social media at Lagos Television #SoundHealth. A sound health is a sound mind. Make healthy living your choice.